Hello everyone, you are watching sqadia.com and I am Dr. Hammad Haider. Today our topic is the lower cervical spine injuries. Today we'll be discussing all the injuries of the subaxial spine. As you know that it is the occiput, C1 and C2 form the upper cervical spine, and from C3 till C7 becomes the subaxial or lower cervical spine. In the first section, we'll be discussing the burst and teardrop fractures of the subaxial spine. Especially we'll be discussing the Ferguson and Allen classification, the SLIC scoring system, which is also called as basically lower cervical spine injury classification. Then they will be discussing the different morphological fractures such as burst and teardrop fractures, as well as the flexion injuries and wedge compression fractures of the subaxial spine. In the second section, we're discussing one very important entity, that is the flexion-distraction injuries, especially during the trauma when the neck goes in hyperflexion and there is continued deceleration leading to flexion-distraction type of injury. We'll be discussing the bilateral facet dislocation as well as the unilateral facet dislocation and management of the unilateral as well as the bilateral facet dislocations. In the third section, we'll be going through the hyperextension and other types of injuries. Hyperextension and double injury, we'll be briefly discussing that. What is avulsion injury of the C7 process, although it's very rare. And it's not something which is very worrisome as well, but we'll be briefly going through the management of C7 spinous process fracture. And lastly, another relatively as compared to the lumbosacral spine, it's rare in the cervical spine, but yes, it can occur, and cervical spine disc herniation and neuropraxia of the cervical spine. We'll briefly touching over that as well. Keep watching sqadia.com. Thank you very much.